According to the cloud.
All right. Good morning. My name is Mark Ryle, and I'm the president of the St. Francis Foundation. And we're excited this morning to provide you with an inside look at the COVID vaccinations, the protocol, and the processes at St. Francis Memorial. We have with us today Dr. Saman Kannangara, who is an infectious disease doctor at St. Francis Memorial, and Dr. Kathleen Jordan, the former chief medical officer. I'll turn it over to the two of you.
Hi, good morning. This is Saman Kannangara. I'll get started today talking about the two COVID-19 vaccines that recently got emergency use authorization. One question is about the efficacy of the COVID-19 vaccines. The two vaccines that recently got emergency use authorization are both highly effective. That's the Pfizer, BioNTech, and Moderna COVID-19 vaccines. And just to define what vaccine efficacy is defined as the percentage reduction of disease in a vaccinated group of people compared to an unvaccinated group. So you can see the Pfizer BioNTech vaccine is 95% effective in preventing symptomatic COVID-19 disease, and the Moderna vaccine is 94.1% effective. So the two are both highly effective. And this is cutting edge technology with these two vaccines. The Pfizer vaccine was the first messenger RNA vaccine to get emergency use authorization. The messenger RNA vaccines have strands of genetic material called mRNA inside a special coating. That coating protects the messenger RNA from enzymes in the body that would otherwise break it down. It also helps the mRNA enter the muscle cells near the vaccination site. And the messenger RNA, it can be described as instructions for the cell on how to make a piece of the spike protein that is unique to the COVID-19 virus. And since only part of the protein is made, it does not do any harm to the vaccinated person, but generates an immune response with protective antibodies. And after the spike protein is made, the cell breaks down the messenger RNA strand and disposes of it using enzymes in the cell. The messenger RNA strand never enters the cell's nucleus or affects the person's genetic material. And once displayed on the cell surface, the spike protein causes the immune system to begin producing antibodies, which means your immune system is primed to protect against future infection. And this is just a simplified schematic of how the messenger RNA vaccine works. So the messenger RNA for the spike protein of coronavirus, it's injected into a muscle in the upper arm, and then the vaccine triggers the production of spike protein and antibodies specific to it. The messenger RNA that was originally injected degrades by the body. So in terms of vaccine distribution and prioritization, some of the vaccine has already started rolling out last week. So phase 1A are the frontline healthcare workers. That's about 21 million people, and residents of long-term care facilities, which is about 3 million persons. And then within healthcare workers, those with the highest risk of COVID-19 exposure are vaccinated first. So at St. Francis, that would be the COVID unit, the ICU, and the ER. So I do round on the COVID unit. So I did receive my Pfizer COVID-19 vaccine this past Friday, and the process went really smoothly, and I had no side effects personally. And the reason why long-term care facility residents are included in phase 1A is that they disproportionately account for really a staggeringly high number of deaths in the US. So it's about 40% of COVID-19 deaths in the US. And then the next group of people will be phase 1B essential workers. So those are people that provide essential services like the education sector, food and agriculture, utilities, police, firefighters, correction officers' transportation, and it'd also be people aged over 75 and older. And then phase 1C, which would follow, is adults with high-risk medical conditions and adults over 65. And then how will COVID-19 vaccines help the burden of the pandemic on St. Francis Memorial Hospital specifically? So healthcare workers account for an estimated 12% of US cases and 0.5% of US deaths from the coronavirus. So for healthcare workers, vaccination of us on the front lines battling the coronavirus, it'll help keep healthcare workers safe and to allow them to continue working. If a healthcare worker gets sick, they would need to be quarantined and self-isolate at home so they could be taken out of the workforce if they do get sick. And then vaccinating long-term care residents and others at high risk, and later the general public will likely decrease COVID-19 related hospitalizations. And in terms of vaccine capacity, 2.9 million doses of the Pfizer BioNTech vaccine shipped last week. And then this week, we expect 5.9 million doses of the Moderna vaccine to be shipped, and an additional 2 million doses of the Pfizer BioNTech vaccine. So there is a goal for 20 million people to be vaccinated by the end of this year, 2020. I'm not sure if we'll make it, or it could be into the first week or two of January. So the Moderna vaccine will definitely help with our vaccine capacity for COVID-19 as that rolls out this week. And then what burden is the pandemic placing on the hospital? There are, I guess, numerous issues that are presented from the pandemic. So there's definitely a strain on the healthcare workforce in terms of an increased volume of patients, the risk of exposure to healthcare workers, and how the hospital capacity needs to expand to manage the pandemic with a limited workforce. There's healthcare worker stress and burnout. The COVID-19 pandemic, it has been pretty relentless since March, so it's been going on for months with a lot of stress on healthcare workers. There are other challenges, like there's challenges continuing other medical service lines in parallel while caring for COVID-19 patients. All of the infection control precautions need to remain in place. There are visitor restrictions as well. There can be financial strain on employees if hours have been reduced from the pandemic, especially for non-clinical workers or those supporting elective services. There's financial strain on the hospital with reduced elective surgeries and outpatient visits. There's strain on our personal protective equipment supplies, which are used in high volumes when we have COVID-19 patients. Then I'll go on to comparing the Pfizer BioNTech and the Moderna vaccines, giving you a comparison of them. So the target population, the Pfizer vaccine is indicated for persons age 16 and older, and the Moderna age 18 and older. The vaccine efficacy, we mentioned this before, but they're both highly effective. Pfizer 95% and Moderna 94.1% at prevention of symptomatic COVID-19 infection. The number of doses, it's a 2-dose series for both. The interval between doses for Moderna is 28 days. So you would get 1 shot and then 28 days later get the second shot. And then for Pfizer, it's 21 days. You would get 1 shot and then 3 weeks later get the second shot. So side effects, most of them are common side effects that can be seen with other vaccines. So pain at the injection site, fatigue, headache, muscle pain, and joint pain. The good thing is most of these common side effects resolve within 24 hours. And then there have been a few severe allergic reactions reported with the Pfizer vaccine. When I got my vaccine at St. Francis or both hospitals, the people getting the vaccines are monitored for 15 minutes afterwards for any allergic reactions, and the allergy or epinephrine kit is close by if needed. And then safety for those pregnant or lactating. So neither of the vaccines has been tested in these two groups. And then storage requirements, Moderna's is shipped at is shipped at a standard freezing temperature, and Pfizer needs to be shipped and stored at an ultra cold temperature. So the Moderna logistically will be easier to store and ship. And then I'll turn over the next slide to Dr. Kathleen Jordan about what we don't know yet.
Thanks, Dr. Kannangara. Just as you and I discussed, it's very important for us to understand what we don't know yet. The trials were very large scale and gave us a lot of information, and certainly enough to get vaccinated, but we still don't know quite a bit. There's 58 manufacturers working on vaccines, including some other major players like Johnson & Johnson and AstraZeneca. Those trials have yet to come to fruition. We're expecting Johnson & Johnson's to come out in February, and AstraZeneca's timeline looks like we'll have results in January. These use a different technology. They don't use the mRNA technology. So we're waiting to see the efficacy and if those vaccines are approved as well. This would have a major impact on supply and when we could expect the rest of the world to get vaccinated. In particular, the AstraZeneca one is very shelf life stable and is intended for use in remote areas and some of our countries not as affluent as the United States. So this would have a major impact worldwide as well as locally. They are working on distributions through CVS and Walgreens, and then distribution overseas as well, but it would obviously depend on which vaccines are approved and what their shelf life stability is. And Pfizer is also working on making theirs more shelf life stable for easier distribution. The other big things we don't know is we don't know the difference in immunogenicity between the various vaccines, and manufacturers will be looking for that data as it comes out over the coming months. But the big thing is we don't know what it does in kids. So while Pfizer included some people between the ages of 16 and 18, no one in those groups actually got disease, either in the placebo group or in the vaccinated group. And this has played out at where we're seeing kids are not usually getting severe disease, which was the endpoint in that trial. So we do have some safety data in kids between 16 and 18, but we're still looking for trials for younger children. Obviously, everybody's eager to know when our kids can return to school, and our susceptible populations are curious as when they can see their grandchildren again. So this is something we should look for in the coming months as well. I believe the AstraZeneca trial has kids over 12, but this will evolve over the coming months and something we should look for. We also don't know the duration. Will the vaccine work very long? Are we going to have to get vaccinated every 3 months, every 12 months, every 2 years? Will the vaccination last for 10 years? So they're going to follow these groups for over 2 years and follow their immune status as well as their vulnerability to disease. So this is something we all need to look out for because it will have implications long-term for us. But the biggest thing for the vaccine right now, and for you probably, Dr. Kannangara, is that the trials didn't tell us whether the patients got infected or if they transmitted disease. The endpoints were were if they got severe disease or death. So patients may have been immunized, still gotten low-grade viremia enough that they can transmit disease, but that wasn't followed in these trials. And for this reason, even if you're immunized today, you're still instructed to continue to do social distancing, as well as wearing masks and all the usual precautions. So this is something the vaccinated group, which will be a growing number, will be looking for more information on over the coming months. And this will sort of be the answer to our next question is when can we resume group gatherings? Even the vaccinated healthcare workers are still advised to continue social distancing and masking. And then what happens long-term to the 6% in these studies, but others in the 5 to 10% that remain susceptible to disease? particularly if we don't have our children vaccinated and there still have schools where disease can be transmitted. Do those people benefit from higher dose vaccinations? Do they benefit from a third vaccine? Are they going to continue to need testing of people around them? So we still need to be able to manage that 5 to 10%, particularly when you think about it, how it would work at sort of a high-risk community such as an elder care facility. And then, of course, the big concern is that the vaccines will stop working, that the virus will mutate. There's mutations all the time in this virus. We can actually track them, and there's a study at UCSF doing that based on sort of what mutations they have in them. But none of the mutations detected to date suggest that the vaccinations will not work. So to date, we seem to be good on that front, but that is always the concern. That's what got us here to begin with. Did you have anything else you wanted to add, Dr. Kannangara?
Yeah, I guess another question is when will we see the impact of vaccination? And I think it's hard to say, probably maybe in the first quarter of 2021. I think as more vaccines roll out and we include more of the public, perhaps we'd see a decline in hospitalizations. And then the other question is what's going to happen in terms of COVID-19 the next few weeks or the next 6 weeks. I've been looking at the data. The cases just keep going up in San Francisco the last couple of weeks. So like you said, we do have to continue all of our social distancing, hand hygiene, universal masking. So it will, I'm optimistic that the vaccines will reduce illness and reduce hospitalizations, but I think it is probably at least several months out before we see the impact of that.
Right. It's a good reminder that it can take up to 2 weeks for someone to transmit the disease. And then once you sort of catch the virus, it's often in the second week that you need the ICU care. So you won't see ICU numbers actually decrease for quite a while. And then once you're in the ICU, you can be there for quite a long time. So yes, so thanks, Mark.
Doctors Jordan and Kannangara, just a quick question or a couple of quick questions that we've gotten from our donors and our supporters. First one is, how quickly after receiving the vaccine do you increase your protection from infection? And then what happens if in the first dose versus the second dose?
Okay, I can answer that. So I just had the vaccine, so I looked at that. So with the Pfizer vaccine, after the first dose, you'll have 50% protection, and that usually happens a week or two after after you receive the vaccine. So you are susceptible to catching the infection like in that period. And then after the second dose, that's when the efficacy goes up to 95%. And then you'll see the effect of that 1 or 2 weeks after receiving the second shot in the series.
All right, thank you for that. And I assume this a similar process in the Moderna vaccine?
Yeah, I believe so.
Yeah, Moderna was about 2 weeks post your second vaccine when you get your peak efficacy.
All right. We really wanted to thank you for your time today. The foundation always wants to try to bring experts together to help folks better understand where we are in this pandemic. And so much gratitude to Dr. Kannangara and Dr. Jordan for your time this morning and helping our audience understand better where we're going and what the optimism looks like going forward. So thank you both very much for your time and for all your support always.
Thank you.
Thank you. Bye.
Bye-bye, y'all.